What vague symptoms delay pancreatitis diagnosis? Imagine feeling unwell with some discomfort that seems minor at first. That's often how pancreatitis begins. It is an inflammation of the pancreas that can show up with symptoms that are not very specific, which makes diagnosis tricky and sometimes delayed. The most common sign is abdominal pain. Usually it's in the upper part of the belly and might radiate to the back. Sometimes the pain is severe and persistent, but other times it comes and goes, which can make people think it's just a stomach ache or indigestion. Because the pain isn't always constant, it can lead to delays in seeking medical help. Nausea and vomiting are also common. These happen because the inflamed pancreas irritates nearby tissues. But nausea and vomiting are symptoms shared by many gastrointestinal issues, like stomach bugs or food poisoning, so they don't immediately point to pancreatitis. Loss of appetite is another vague symptom. When the pancreas is inflamed, digestion can be affected, leading to reduced hunger. But many illnesses cause appetite loss, so doctors might not think of pancreatitis right away. Some patients develop a fever, which can be mistaken for infections like the flu or other illnesses. Fatigue or feeling very tired is also common but nonspecific. It's a general sign of inflammation or illness, not unique to pancreatitis. Several factors contribute to delayed diagnosis. Symptoms may come and go, which can give false reassurance. For example, if the pain or discomfort subsides temporarily, people might ignore it or delay seeing a doctor. Also, because these symptoms overlap with other more common conditions like gallstones, peptic ulcers, or irritable bowel syndrome, healthcare providers might initially misdiagnose or overlook pancreatitis. Lack of awareness plays a role too. Patients might not recognize their symptoms as serious, especially if they are mild or intermittent. Healthcare providers might not immediately think of pancreatitis if the presentation is atypical or if they are unfamiliar with the condition. Early detection is crucial. If symptoms persist or worsen, it's important to seek medical attention promptly. Doctors can use imaging tests such as ultrasound or computed tomography scans to look for signs of inflammation or damage in the pancreas. Blood tests measuring pancreatic enzymes like amylase and lipase can also help confirm the diagnosis, especially if they are elevated. Understanding your medical history is important too. Risk factors like gallstones or heavy alcohol use can raise suspicion for pancreatitis. Recognizing these factors can guide doctors to order the right tests sooner. In the context of pancreas health and pancreatic cancer, catching pancreatitis early matters because chronic pancreatitis is a known risk factor for developing pancreatic cancer later on. Since the symptoms of pancreatitis can resemble those of pancreatic cancer, timely diagnosis and management are essential. Always consult healthcare professionals if you experience persistent or worsening symptoms, and remember that each person's situation is unique. Proper medical evaluation and testing are the best ways to ensure accurate diagnosis and appropriate care.